Hey ladies, welcome to GOC Grace channel. It's time to explore more about your body once again. In just a few minutes per day, you can take control of your health and well-being. Our advice is that you do not try to take care of your health on your own. Consult with a doctor for advice. On this post, we will talk about everything about cancer. Stay tuned. Cancer is a group of diseases characterized by the uncontrolled growth and spread of abnormal cells. If the spread is not controlled, it can result in death. Unlike normal cells, cancer cells do not respond to the body's regulatory mechanisms and may invade surrounding tissues or metastasize spread to distant organs. Key characteristics of cancer cells: uncontrolled cell division, resistance to cell death, apoptosis, ability to invade other tissues, induction of angiogenesis, blood vessel formation, evasion of the immune system, genetic instability and mutation accumulation. Causes and risk factors. Cancer is multifactorial, caused by a complex interplay of genetic, environmental, and lifestyle factors. Genetic causes: inherited mutations, for example, BRCA1/2 in breast cancer, oncogenes mutated genes that promote cell division, tumor suppressor genes, for example, TP53, DNA repair gene mutations. Environmental and lifestyle factors: tobacco smoke linked to lung, mouth, bladder cancers, radiation exposure, UV rays and ionizing radiation, carcinogenic chemicals, asbestos, benzene, infections, HPV in cervical cancer, hepatitis B or C in liver cancer, H. pylori in stomach cancer, diet and obesity, alcohol consumption. Types of cancer. Cancers are classified based on their tissue of origin. Major categories: carcinomas arise from epithelial cells, for example, breast, lung, colon; sarcomas from connective tissues, for example, bone, muscle; leukemias from blood-forming tissues; lymphomas from lymphatic tissue; myelomas from plasma cells; central nervous system cancers, brain and spinal cord. Pathophysiology and mechanisms. Cancer development is a multi-step process that involves several stages. A. Initiation. A genetic mutation alters the DNA of a single cell, often due to carcinogen exposure. B. Promotion. Mutated cells proliferate abnormally, but remain non-invasive. C. Progression. Additional mutations lead to malignant behavior, such as invasiveness, angiogenesis, and metastasis. Hallmarks of cancer: Hanahan and Weinberg. 1. Sustaining proliferative signaling. 2. Evading growth suppressors. 3. Resisting cell death. 4. Enabling replicative immortality. 5. Inducing angiogenesis. 6. Activating invasion and metastasis. 7. Genome instability and mutation. 8. Deregulating cellular energetics. 9. Avoiding immune destruction. 10. Tumor promoting inflammation. Diagnosis. Clinical signs and symptoms: unexplained weight loss, fatigue, lumps or masses, persistent cough or hoarseness, changes in bowel or bladder habits, unusual bleeding or discharge. Diagnostic techniques: imaging, X-ray, CT, MRI, PET scans, biopsy, tissue sample analysis, blood tests, tumor markers, for example, PSA, Ca125, molecular testing for gene mutations and markers. Cancer staging and grading. Staging refers to the extent of cancer spread, TNM system, tumor size T, node involvement N, metastasis M. Stages I of early to advanced. Grading evaluates how abnormal cancer cells look. Low grade equals well differentiated, less aggressive. High grade equals poorly differentiated, more aggressive. Treatment of cancer. Treatment depends on the type, location, stage, and individual health. Main modalities include A. Surgery. Removal of tumor, often effective in early-stage solid tumors. B. Radiation therapy. High-energy radiation to kill or shrink tumors, can be curative or palliative. C. Chemotherapy. Cytotoxic drugs that kill fast-dividing cells, can affect normal cells, causing side effects. Targeted therapy. Drugs designed to target specific molecules. For example, HER2 inhibitors, tyrosine kinase inhibitors. E. Immunotherapy boosts the body's immune response against cancer. For example, checkpoint inhibitors like PD-1, PD-L1 blockers. F. Hormonal therapy used for hormone-sensitive cancers. For example, tamoxifen for breast cancer. G. Stem cell transplant, especially in hematologic cancers like leukemia. Prevention and screening. Lifestyle modifications. Quit smoking. Healthy diet and weight. Limit alcohol, physical activity, sun protection, safe sex and vaccination, for example, HPV vaccine. Screening tests. Mammogram breast cancer. Pap smear cervical cancer. Colonoscopy colorectal cancer. PSA test prostate cancer. Low-dose CT scan lung cancer in smokers. Early detection greatly improves survival outcomes. Prognosis and survival depends on cancer type, stage at diagnosis, treatment, and individual health. 5-year survival rates vary widely, high for localized prostate, thyroid, breast cancers, lower for late-stage pancreatic or lung cancers. Cancer research and advances. Ongoing research focuses on A. Genomics and precision medicine, tailoring therapy to genetic mutations in tumors. B. Liquid biopsies, detecting cancer DNA from blood samples for early detection. CAR T-cell therapy, engineering patients' T-cells to target cancer cells. ESP in leukemia lymphoma. D. Artificial intelligence, enhancing diagnosis, treatment planning, drug development. E. Cancer vaccines, preventive, for example, HPV, hepatitis B, and therapeutic. Experimental. Psychosocial and economic impact. Cancer affects not just the body, but also mental health, family dynamics, and finances. Survivorship programs and palliative care are essential to improve quality of life. Cancer disparities based on race, income, and geography remain a major concern. Conclusion. Cancer remains one of the leading causes of death worldwide. Despite the challenges, advances in science and medicine have led to earlier diagnoses, more effective treatments, and higher survival rates for many cancers. A multidisciplinary approach involving prevention, early detection, personalized care, and continued research is key to further improving outcomes. Drop your question in the comments section if you have any, and please help us to share so that it can get to the least women out there. Do not miss our next post on types of cancer. See you then.